Hi everyone, welcome back to the Australian Rotary Health podcast called The Research Behind Lift the Lid. I'm Jessica Cooper, and on our 32nd episode, we will be having a chat with Dr Alana Fisher from the University of Sydney. Australian Rotary Health awarded Alana's colleague, Professor Ilona Juroskova, a mental health research grant from 2017 to 2018 for the project Enhancing Treatment Decision-Making in Bipolar II Disorder, evaluation of an online decision aid for young adults. Under Ilona's mentorship, Alana led this research project, which built on her work in her PhD in psychology, which she completed in 2018. Alana has since joined the Matilda Centre as a postdoctoral research fellow, where she has developed a decision aid for people with co-occurring depression and risk alcohol use who are deciding on treatment. So it's really great to have you on our podcast today, Alana. How has the year been treating you so far?
So far so good. Yeah, I've just started a new job this week, so as we were mentioning before. So yeah, I'm tackling on some new projects as well.
Yeah. So where are you based now? Because I had said.
So as of this Monday, I'm now at the eCentre Clinic, which falls under the MindSpot banner, and they're based at Macquarie University. Okay. So they basically deliver test and deliver digital mental health services.
Oh, good. Yeah. Well, I hope it goes well for you.
Thank you.
So it certainly sounds like this would have been a very interesting and exciting project to be doing a PhD on. I guess, can you tell me where the idea came from to develop an online decision aid for young adults with bipolar II disorder?
So before starting my PhD, I actually worked as a research assistant for Alona. And when I was working for Alona, I was working on trials of decision aids to encourage shared decision-making about treatment for people with cancer, so including breast cancer and ovarian cancer, prostate cancer. And so with my background in psychology, I could see that there was a need to facilitate shared decision-making through the use of decision aids for people with mental health conditions. And the reason why I guess bipolar 2 stuck out to me was there were already decision aids at that time for depression and for schizophrenia. And I guess compared to bipolar 1, bipolar 2 has much more limited evidence to support the different treatment options. And so decisions about treatment can be more finely balanced in terms of what are the potential benefits versus what are the potential drawbacks or side effects of the different options. And I think another thing to consider too is that what was coming out in some of the initial work that we did was that people are can be quite uninformed about the different side effects of medications in particular. So things like lethargy or weight gain or brain fog. And then some people might also have unrealistic expectations that once they're well, they no longer actually need to be taking their medications anymore. And so these often turn out to be the main reasons why people stop taking their medications. So I guess really from all of that, I could see that there was a need for people to be informed about symptoms and about potential side effects, and also to actually consider the treatment options, not only based on the evidence that's available, but also consider their values, what's important to them, and what matters to them. So it was really out of this that a decision for a decision aid sort of came to be, really.
Yeah, it certainly sounds like it would be very helpful for people who are experiencing bipolar 2. And I guess if someone was experiencing bipolar 2 disorder and they wanted to look at something like this, what could they expect from using this online decision aid?
Yeah, so I guess when people do open the website, I guess the standout things are that it provides clear and easy to understand information that is based on evidence and is not biased or directional in any way. And it presents the first choice medication and psychological treatment options for bipolar II disorder. So the options that it presents are based on current clinical guidelines for bipolar disorder, as well as up-to-date and high-quality evidence from systematic reviews and meta-analyses. So another important thing is, as well as using clear and easy to understand information, we also include graphics, and we've made sure to have everything in plain English. So we've cut out the jargon as much as possible, but we have also included a glossary where needed for specific medication terms and things like that. So and the other thing is that as this was a resource for young people, we included a number of modules which covered topics that might be of particular use to young people. So particularly young people when they're newly diagnosed. So some of the topics that we included were, I guess, managing relationships romantically and with friends, strategies for keeping well, how to form independence in making decisions about your treatment, and possible interactions between, say, prescription medication as well as the use of alcohol or other drugs. So I think, as I mentioned earlier, one important aspect was that the information is unbiased and it's not directional. So it doesn't seek to push people towards one particular option or another. It really tries to give people an awareness of choice, and it points out that based on the current evidence, there is no single best choice available, but rather that the right choice for you is based on an understanding of the best available evidence, being properly informed and considering what is important to you and what your preferences are. So, and I guess one other important sort of tool, which is included in the website too, and really what I think differentiates it from plain patient information about treatment is that it includes what are called values clarification exercises. So within the website, these are presented as interactive weight scales. And it really gets people to weigh up the pros and the cons of the positive and the negative features of the different treatment options available. And so that people can see which option or options they might be leaning towards. And so I guess in this way, it provides some structured guidance in terms of people being able to make a choice that's based on their informed preferences for treatment. Yeah.
Yeah, that sounds like it would be really helpful. And, rather than being bombarded by information, it sort of gives them a step-by-step guide to kind of get to that end point and decide what treatment to try. And I guess as well, some treatments wouldn't work for everyone. So, having those different choices, I think that, sounds like it would be really helpful.
Absolutely.
Yeah. Great. Well, I know that, this grant from Australian Rotary Health only covered the evaluation part of the Decision Aid website. So I guess it might have been a relatively small part of your PhD overall. But what did this part of the process involve?
So I guess my PhD focused more on actually developing the content and the format of the decision aid, and then actually piloting this content and format, and then that formed the basis of the website itself. So initially what we did was we conducted a comprehensive literature review, which basically just sought to understand, I guess, the current landscape in terms of what are the sort of challenges that people face when they're making decisions about their treatment in mental health. How involved do they wish to be in their treatment? How involved do they currently feel in making decisions about their treatment? As well as possible strategies for improving patient involvement in decision-making about their treatment, and as well as potential benefits or advantages of actually involving people in making decisions about their treatment. So I guess this review sort of, it gave a good synthesis of the evidence that was out there, but it also identified a number of knowledge gaps. And then so from that, I conducted a series of qualitative interviews with key stakeholders. So with people that had a lived experience of bipolar II disorder, as well as their family members and treating clinicians. And this sort of, I guess, tried to nut out a little bit more what were the needs and what were the preferences for decision support and for information for bipolar 2 population specifically. And then sort of, I guess, based on the findings, both from the review and from the interviews, I then drafted the decision aid content. And once we had a draft of that, we consulted with an expert working party, again, made up of clinicians, family members, and people with bipolar 2 disorder. And at this point, we also included researchers who had expertise in developing decision aids and similar sort of patient resources. And we sort of had a back and forth process. It underwent sort of several rounds of feedback, and then we finally came to a consensus on what the decision aid should actually look like. And from there, we engaged a graphic designer as well as a copy editor to sort of, I guess, sort of make the decision aid look prettier and also make the language more accessible to users. And then the final stage of my decision aid, which the final stage of my PhD rather, was actually piloting and just working out, was this content acceptable? Was it feasible for people to use? Was it safe for people to use? And then I guess that was sort of around the point that I received funding to actually then build the website, so which sort of built on all that work.
Yeah, oh, it sounds like it was a very big process, but a very exciting process as well, you know, starting the beginning stages, developing the website, and then eventually, you know, testing the effectiveness of it. So yeah, it sounds like it would have been very exciting to do that. Could you tell us about some of the key findings from that evaluation?
So when we did eventually do the RCT evaluation of the website, we initially asked people, obviously people that did have access to the website, we asked them for their feedback on it, and they found that it was easy to use and that it was useful. Almost uniformly, people expressed positive attitudes towards using the website and said that they would recommend it to others in their situation. And people also, importantly too, felt that this was credible and trustworthy information that wasn't pushing them in one particular direction or another. And when we made comparisons between people who received access to the decision aid versus people that received access only to online treatment information that was already available, we found some evidence that using the decision aid actually supports better quality decision-making about treatment. So we found, for example, that people who had access to the website were more knowledgeable about the available treatment options. They felt more certain about the options that were available to them. And they felt more comfortable making a decision, and they also felt better prepared to actually make a decision with their clinician on the basis of having access to this website. So another thing too was that we then followed up participants 3 months later to see whether any of these effects or what the longer term effects of having access to this decision aid might be. And we found that the group who had had access to the decision aid website was still more knowledgeable about the treatment options compared to the control group. And that they also expressed less regret about the choice that they had made in terms of their treatment, which I guess is particularly important in thinking that, you know, having regret about a choice that you made can have obviously quite negative psychological effects, and I guess also derail your adherence or your engagement with treatment. So I think another thing too is that there can also sometimes be this concern that providing people with information about the side effects of treatment or expressing uncertainty around which treatment option is best can actually be quite worrisome and quite anxiety provoking for people. So we actually also compared the anxiety levels of people who had accessed the Decision Aid website versus those that hadn't, and we didn't find any differences there. So importantly, receiving this information doesn't seem to be anxiety provoking either.
Yeah, well, there definitely sounds like there were some really great findings there. And I think what was, kind of stuck out to me was the, not having regrets about their treatment. Is that something that people with bipolar 2 does that usually occur for them, having regrets?
I think in Although we didn't, I guess, formally measure that in other stages of the research that I did, it was something that came up, I guess, sort of anecdotally in some of the interviews that we were doing, that people had expressed regrets about the treatment that perhaps they'd been prescribed, perhaps they'd been prescribed medications that weren't in line with their preferences previously. And I guess there was sometimes a resentment that perhaps they hadn't been properly informed about particular side effects or the particular sort of just negative impacts that a particular medication might have on their life. And so that was sort of certainly a theme that was coming through in the interviews.
Yeah, very interesting. Yeah, it's good to see that that's really improved, their decision making. And I guess in terms of like wider implications and helping people who, in the real world have bipolar 2 disorder, what kind of implications could this have, do you think?
Yeah, I mean, I think the fact, importantly, this website is it is freely available. It is publicly available, obviously to people here in Australia, but also overseas. And so we really think that the evidence that we have at least certainly supports its potential for helping people to be more informed and more actively involved in making decisions about their treatment. And I think sort of we can feel reasonably confident in this because we did go to great lengths to develop the decision aid with real life end users in mind. And so we did involve people with lived experience at every step of the development and the evaluation process. And this was not only in terms of participants, obviously, but also getting people to advise on what sort of information they want, how they want this information to be presented, and how we can actually best support people to make informed choices.
Yeah, and so I guess continuing on from this research, are you still doing research in this space with bipolar disorder, or are you looking into other areas at the moment?
So I haven't I haven't sort of expanded further on my work in bipolar. I've moved on more to, I guess, looking at decision support tools within the context of co-occurring conditions. So for example, I've just finished and we're just about to start piloting a decision aid for people that have co-occurring depression and alcohol use issues. And just because there can sometimes be different considerations compared to if someone has depression as a standalone condition or alcohol use disorder as a standalone condition. And really, I guess, the need to take an integrated approach and to tackle these conditions together in treatment. So again, deciding what are people's priorities and needs for treatment at the time.
Yeah, great. Yeah, it certainly sounds like an interesting area, and there's so much that you can do with that, and I guess so many different mental health problems that might benefit from having a decision aid. So yeah, that's great.
Yeah.
So I guess for anyone listening who may be struggling with bipolar 2 disorder, where might they access this website? And do you have any other tips that might be helpful for them?
Good question. So as I mentioned earlier, the website is freely available. It's hosted by the Black Dog Institute at the moment, and you can find it via the URL www.bipolardecisionaid.com.au, or alternatively, you can just Google bipolar decision aid and it will come up in your search results. I think in terms of some tips for using the decision aid, I think it's important for users to keep in mind that this is just one resource for helping them to make a decision about their treatment. It's a starting point, it's a conversation starter, and that really it's designed to be used in conjunction with discussions that they're having with their clinician, as well as other important people in their life, such as their partner or their family or friends. And I think another thing which people, at least in the qualitative interviews, told us is that decision-making about treatment isn't a discrete time point. It really is an ongoing process, and that quite often decisions about treatment are revisited and revised based on how someone might respond to treatment or any changes in their life circumstances or symptoms. So I would encourage people to use this resource flexibly, and to access the website and use sections of the resource that are relevant to them at a particular point, and that it may be useful, obviously, for people who need that additional support when they're newly diagnosed, but also likewise, we've been told it's useful by people who have a longer standing diagnosis as well.
Yeah, well, thank you for those tips. I'm sure they'd be very helpful for anyone who is experiencing that and might want to use that website. So excellent. You might already know that most of our funding comes straight from Rotary clubs and districts in Australia who are out there in the community raising money to make a difference to mental health. Could you explain how their donations may have personally helped you in your research career?
Yeah, I think quite immensely, and from a career point of view. So I think receiving this grant gave me the opportunity, while still being a PhD student, to be a lead co-investigator on a competitively funded project, and also allow my decision aid that I developed as part of my PhD to be rigorously evaluated and ultimately be widely available for people in the Australian community. And I think also receiving this grant so early on in my academic career has set me up to be competitive as an early career researcher. And I definitely credit it with later successes that I've had in my career, such as obtaining a research fellowship now to do my own project. Yeah.
Well, that's great to hear. Like, I know our Rotarians always like to hear, the real impacts and, that their funding has made on people's lives. And so, that's really great. And I can see that their funding has really gone towards something worthwhile in terms of helping real people as well. So, that's excellent. I guess, just one last question. How important do you think it is that we continue to support mental health research, particularly into bipolar disorder?
Well, I think that affective disorders, which obviously include depression, but also include bipolar disorders, are amongst the most costly and burdensome mental health conditions. And much of that burden is carried by people in the peak of their lives. So both young people and people when they're young adults and emerging adults. And I think that mental health research helps us to better understand what is needed and what works and why. And this can actually be useful in preventing people, both individual consumers as well as people in government, from investing their time and their energy and their money into things that do not work, or may actually produce negative effects or harms. So I think that mental health research is also a good investment. I have come across statistics saying that every dollar which is invested in mental health care produces up to $65 in savings in terms of reduced leave and absenteeism. And I think, with all that said, we need mental health research in the first place so that we can make informed choices about where and how this dollar is spent in the first place.
Yeah, well, it's really good to kind of have that, the way that you just explained that. Every dollar for having $65 in savings.
$65, yeah.
That's amazing. So it's good to kind of have it put that way. I'm sure that'd be really helpful for Rotarians to know. So thank you so much again, Alana, for joining me on our podcast today. And I guess before we wrap up, was there anything else that you'd like to add?
I think the only thing that I guess I'd want to make our listeners aware of is that when they're thinking about and seeking treatment for their own mental health concerns, that they often have a choice of evidence-based options available to them, and that the decision about which one's right for them should incorporate not only the clinician's expertise, but also their own expertise as someone who has knowledge of what is important to them, what matters to them, and what are the potential impacts that treatment's going to have on their life. And I think that in this way, it's sort of empowering, and to know that really there are two experts in the room when you're sitting down to make a decision about treatment.
Yeah. Oh, excellent. Well, I'll definitely put that website link in the show notes so that if anyone is interested, they can always click on that and yeah, have a look through. So yeah, well, thank you so much again. It's been really great
Thanks.
to talk to you.
It's been great to join you today. Thanks.
Thank you. That was the 32nd episode of our podcast called The Research Behind Lift the Lid. It's always so inspiring to hear what researchers in Australia are doing to make a difference to mental health and how they are helping us on our mission to lift the lid on mental illness. If you can, please support important mental health research like Alana's by donating on the Australian Rotary Health website. Thank you for listening. Please join us again next time.